Rahim. Hello friends. Today we will discuss about the cranial nerve examination part 2, and we will start from trigeminal nerve. Nerve is a fifth cranial nerve, and it's important in dental BDS course. So trigeminal have sensory and motor branches. The sensory branches are subdivided into three branches, which are represent V1, V2, V3, or Roman number 5-1, 5-2, 5-3. We have ophthalmic, maxillary, mandibular branches of the trigeminal, which is a sensory branch, and we have a motor branch as well, which supply the muscles of mastications, which are temporalis, masseters, medial pterygoid, lateral pterygoids, and other muscles which are supplied by motor branch of trigeminal nerve is tensor villi palatini, myohyoid muscles, anterior belly of digastric, tensor tympani, all involved in the biting, chewing, swallowing, except for tensor villi palatini, tensor tympani, which act to dampen sound produced from chewing. First of all, as there is a sensory branch, so uh, we will examine the sensory parts of the trigeminal nerve. We ask the patient, say yes if you feel these. We test for soft touch using cotton wool sternum first, close eye. We will ask the patient to close this eye in the three divisions of the nerve: ophthalmic, forehead up to the top of the head, maxillary, and mandibular up to the angle of the jaw. The patient should be instructed to say yes each time the touches the cotton wool is felt. Do not stroke the skin, touch it. Test for pain using a sharp object like needles. Ask the patient, does it feel sharp or dull? Causes of the sensory problems: plaque in the plaque in the brainstem in young people, Sjogren's syndrome, dry eyes, dry mouth, trigeminal neuralgia, older patients. Then we will examine for the corneal reflex. Ask the patient to look up and away. Touch the corneal reflex. Blinking of the both eyes is a normal response. And say the patient, I am going to gently touch your eye with a cotton bud. Pathology: Bell's palsy, unable to blink due to damage the afferent limbs, which is as facial cranial nerve 7, cranial nerve 5 form the afferent limbs. Motor: can you grit your teeth please? Inspect for wasting of the temporal and masseter muscles. Ask the patient to clench their teeth and palpate for contraction of temporal and masseter muscles. Open up your mouth and hold it for me. Ask the patient to open their mouth and hold it open while examiner attempt to force it shut. Pterygoid muscles. A unilateral weakness of the motor division causes the jaw to deviate through the weak side. If the weakness is suspected, patient should be asked to move the jaw laterally against the resistance. The jaw can be moved towards the affected muscles, but cannot move towards the normal side. And we will go for the jaw jerk, and we will say to patient that I am going to gently tap your jaw. Ask the patient to open her mouth fully and to close halfly. Place index finger on her chin and tap with a patella hammer. If the jaw jerk is highly exaggerated, help to distinguish between pseudobulbar palsy, uni lesions of the lower cranial nerve 9, 10, 11, 12, and a bulbar palsy, which is lower motor neuron lesions of lower cranial nerve 9, 10, 11, and 12. And we have a facial nerve, which is also important in the dentistry. The facial nerve has four components. From the facial nerves, we have brachial, motors branches, parasympathetic, sensory, and test branches. So, uh, the brachial branch, petrous temporal bone, intermaxillary, and the sensory branch is divided into five: temporal, zygomatic, buccal, mandibular, and cervical. Motor. How how we examine the motor branch of the facial nerve? Ask the patient to shut the eye tightly and observe, and try to force open each eye. If the lower motor neuron lesion is detected, weakness on one side of the face, check for ears and palatal vesicles of herpes zoster or of the geniculate ganglion, the Ramsay-Hunt syndrome. Motor. Ask patient to look up and wrinkle her forehead. Feel for muscle strengthened by pushing down on forehead. This movement is preserved on the side of upper motor neuron lesions. A lesions which occurs above the level of the brainstem nucleus because of a bilateral supranuclear innervation, giving some compensation to the upper face, which is not the cause of lower motor neuron lesions, Bell palsy, Ramsay Hunt, herpes zoster. The remaining muscles of facial expressions are usually affected on the side of an um, upper motor neuron lesions. In a lower motor neuron lesions, all muscles of facial expression are affected on the side of the lesions. And now we will motor examination is continue. Ask the patient to show their teeth. Compare the nasolabial groove, which are smooth on the weak side. Left upper motor neurons, seventh nerve lesion lead to drooping of the corner of the mouth, flattened nasolabial fold, and sparing of the forehead on the left side. And we will go for the buccinator muscles. So uh, we ask the patient to blow out your cheek, and we will press again, force applied on the cheeks if the buccinator muscles branch of facial nerve is intact, so it cannot be compressed. And we will go for the vestibulocochlear nerve, which is at cranial nerve, which have cochlear divisions for hearing and vestibular division for the balance. We goes for Raynaud's test, which is based on the tuning fork on the mastoid process. Tell me when it stops, then bring it to the ear. Can hear it. With nerve deafness, the note is audible at the external meatus as the air of the bone and bone conduction are reduced equally, so that air conduction is better as is normal. This is termed dryness positive. Weber test: a vibrating tuning fork is placed on the center of the forehead. Normally, the sound is heard in the center of the forehead. With nerve deafness, the sound is transmitted to the normal air. With conduction deafness, the sound is heard louder in the abnormal air. Patient with defective hearing should be referred for audiometry. These measures the degree of the hearing loss of different sound frequency. And we have glossopharyngeal nerve, vagus nerve, uvula, and gag reflex. If the uh, 9 and 10 ninth and 10th nerve is intact, so our gag reflex can be intact as well. Accessory trapezius muscles, we order the patient to clench their shoulder upward, and we apply the resistance and ask the patients resist the force which I am applying. And here is hypoglossal nerve, which supply the muscles of the tongue. Motor nerve of the tongue, observe the tongue at rest, resting on one side, fasciculation, stitch out tongue straight, deviate of this one side, tongue deviate to one side of a lesions of the cranial nerve. 12 wiggles tongue side to side, coordination altered in cerebral disorder. Sternocleidomastoid muscles, turn your head against my hand and feel for the uh, sternocleidomastoids is intact or not. Thank you very much. This is the end of the cranial nerve examinations. Thank you very much for listening. Please subscribe my channel Dental Knowledge for daily update.